Hi, I'm Jesse Boyd, and I'm the clinical team lead with Summit Stone Health Partners Co-Response Program out of the Loveland Police Department.
And I'm Maryann Flynn, and I'm a Summit Stone clinician with Larimer County Sheriff's Office.
The Co-Responder Program is a model of criminal justice diversion which pairs law enforcement and behavioral health specialists to intervene and respond to 911 calls that include a behavioral health component. Our teams use the combined expertise of the officer and the behavioral health specialist to de-escalate situations, provide brief therapeutic interventions, and help link individuals with behavioral health concerns to appropriate services.
While relatively new, the co-responder model exists nationwide and is helping change perceptions of mental health and destigmatizing care. The co-responder model prides itself in bridging the gap in communities by reducing stigma and broadening access to mental health services. The program and team structure varies between locations to best meet the needs of the community and partnering agencies, taking population density and other available resources into consideration. There are generally two approaches. The first approach is what we call the primary response model. This is an officer and a behavioral health specialist riding together in the same vehicle for an entire shift. And this is the approach we use at the Larimer County Sheriff's Office.
The Loveland Police Department follows a secondary response model, where the behavioral health specialist follows the officer or meets them at the scene, then tag teaming the call. If needed, this allows us to provide transportation without requiring the person to ride in the back of a police vehicle. On scene, the co-response team works to not only de-escalate the situation, but we also provide behavioral health screening, risk assessment, brief crisis interventions, and then help connect the client to helpful community resources and treatment options. We also provide more than just the initial crisis response. Afterwards, we have a case manager and peer specialist who can follow up with the individual for support and additional resources. When community members have a crisis, they call 911 for help. Having a co-responder with law enforcement helps ensure that people are getting the right kind of support at the right time, with a trained mental health professional providing direct intervention, advocacy, consultation, and support during a behavioral health crisis. We love that we can support people on some of the toughest days of their lives. Let's hear from our partners at Loveland Police Department and Larimer County Sheriff's Office.
Hi, I'm Evey Sanger. I'm a police officer with the City of Loveland.
I'm Cheryl Jacobs with the Larimer County Sheriff's Office. I'm a uniformed deputy portion of our co-responder team.
I think Summit Stone co-responders are super helpful to law enforcement. It's awesome to have real-time on-scene response to help with mental health calls because that's when people need it the most.
I believe pairing a uniformed deputy with a licensed clinician is beneficial for everyone involved. The co-responder team allows law enforcement to return to law enforcement type calls that we are trained to do. It also provides safety and security for the clinician doing the evaluation.
Our co-responders can offer people the help needed in that moment. It's also super helpful to be able to speak with co-responders before going to a scene. They can give advice and in some high-risk situations help with giving backgrounds of some people, which in return helps us law enforcement know how to approach the situation.
It also benefits the citizens of Larimer County by providing them with the most appropriate resources for their situation. This, I believe, has a secondary benefit of helping prevent legal involvement of those experiencing a mental health crisis.
Summit Stone definitely makes my life easier and teaches me something new every time I go on a call with them. Law enforcement primarily focuses on the criminal side of situations, and we don't always see there's something possibly going on with someone, and Summit Stone can help us point it out.
What would you like others to know about being a co-responder?
So I never expected to work with law enforcement when I first started my degree, and I had no idea that there were opportunities like this out there. And I got lucky. I found a passion with this job. I've learned that I think that being a counselor can mean a lot of different things.
Co-responder, when I first started, I didn't even know what that means. Co-response is essentially responding with first responders onto scenes. So I'm a mental health first responder is how I like to think about it. So we're responding with law enforcement, with firefighters, with paramedics, and all about it is us doing things together. So when I think about co-response, it's me partnering with someone else, which I appreciate because I'm a social worker and I love my job, but I'm also in one lane and I need other people to partner with me to do the best job that we can. So that to me is the most important part of my job.
You know, crisis is a subjective thing, right? I mean, it can mean something different for everybody. And so we want to be there with you on a tough day when you might be going through a crisis and try to help you. And in the past, if you were going through a mental health crisis, you might automatically have ended up at the emergency room or in the jail. And that's what our program works to avoid.
What are some challenges to the co-responder role?
I think the challenges are the same as what first responders experience all the time, which is that we are walking into what's usually the most difficult day of people's lives. And that can be just an emotional challenge for first responders, and then also just trying to figure out what is actually going on with all the information coming in through dispatch, through collaterals, through family, and trying to figure that all out.
One of the other, I'd say, biggest difficulties is that there's just too few of us and a lot of calls coming through dispatch. So we're constantly triaging, juggling multiple calls simultaneously, and doing our best to provide good service to people.
The other part that can be difficult is that this job is new. I think as social workers, as professional counselors, as anyone in the mental health field, I think we are all still learning how to be a first responder in this role. So there's a lot we don't know, and there's a lot that we're still trying to figure out.
So work-life balance can be a little bit tough sometimes. We're dealing with crisis situations, which in their nature are a bit unpredictable. And with that comes the difficulty of not always having an answer, not always having a perfect solution for someone, and being able to give them what they're asking for or hoping for. And that's hard. What we're in this field for is to help, and we can't always do exactly what they'd like. And so we do our best, but we don't always hit the mark.
What are some traits that a co-responder might benefit from having?
That's a great question, because I think I'm still learning that. But someone who's good for this job is a strong advocate. I have met, when I went to get my master's degree, most of my peers were maybe more soft-spoken, or they were kind of seen as the helpers of the field. And I was kind of this loud and boisterous female in the group, and I kind of just felt out of place. But I have found there to be a place for me with co-response.
One thing I absolutely love about this job is that no two calls are the same. And I think that if you're flexible, you're quick on your feet, and you like to be creative in your approaches, or you're interested in working with emergency services or being an EMT, a law enforcement officer, but don't want to necessarily be that, this could be a good job for you. If you'd like to learn more about the co-responder role, you can visit the Health Sector Partnership website or your local law enforcement website. We hope you've learned more about this important and unique role in behavioral health.